Margaret, a 59-year-old retired teacher, has chronic knee pain. She's noticed that lately her pain has been getting worse at night, and she wants to know what her treatment options are. A friend of hers mentioned success with receiving acupuncture for pain management. Margaret wants to speak with her primary care provider to discuss the possibility of her beginning to see an acupuncturist and whether or not it might help with some pain relief. Acupuncture, a key component of traditional Chinese medicine, involves the insertion of very thin needles through your skin at strategic points on your body and is most commonly used to treat pain. Traditional Chinese medicine explains acupuncture as a technique for balancing the flow of energy, which is believed to flow through pathways in your body. In contrast, many Western practitioners view the acupuncture points as places to stimulate nerves, muscles, and connective tissue. Some believe that this stimulation boosts your body's natural painkillers. We've asked Enoch Ho to talk about acupuncture and joint pain and the evidence behind it. Enoch is both a registered physiotherapist and acupuncturist and a clinical assistant professor at McMaster University. Thank you so much for joining us today, Enoch.
Thank you. Thank you for having me.
So let's start off with some basics. What exactly does acupuncture do?
I think acupuncture is getting more popular. People more familiar with the use of the acupuncture for pain management. Actually, acupuncture can help with some other condition like anxiety, depression, osteoarthritis, insomnia, and even menstrual cramps. So some studies suggest acupuncture can help with cancer treatment, mostly related to side effect of chemotherapy. But those areas, I think we need a larger scale of study to help us to understand the actual benefit. Some other condition that traditional acupuncture in Chinese medicine claims that they can help like abdominal pain or things like obesity, infertility. But those areas are still new to us without enough evidence to substantiate what they claim that they can be helpful.
In North America, most of the uses for acupuncture would relate to pain management, and some of these other domains are areas that require more study.
I totally agree. Yes.
Are there any risks or side effects with getting acupuncture treatment?
Well, the risks of acupuncture are low. If you have a competent, certified acupuncture practitioner using single disposable needles. Infection, in fact, is the number one adverse event of acupuncture documented in the literature. The next one is organ puncture, like lung puncture causing pneumothorax. Common side effects include soreness and minor bleeding at the location where the needle is inserted to. Nowadays, everyone using single disposable needle, so infection is much less the incidence, but we still hear here and there with some problem. Some other condition that we need to be careful is for people who has like a blood bleeding disorder or taking blood thinner. Certain acupuncture point like intra-articular acupuncture point, then have to be careful when they insert or try to avoid those points. Pacemakers for sure, if we are using electroacupuncture, that could cause interference. If a young lady is expecting a baby, then again, certain point could affect the cause of the pregnancy that we should avoid too.
Sounds like it would be important with a few conditions, as you mentioned, like a bleeding disorder or having a pacemaker, that you should definitely discuss that with the person who's going to perform the acupuncture in advance.
And we should screen properly before we actually apply the needle.
And in the just to recap too, while the number one side effect historically might have been infection related to needles, it sounds like with single-use disposable needles, that's really much less of an issue right now.
We still hear from situation, for example, in the clinic, that acupuncture treatment combined with massage. So acupuncture is safe, but what happens is the skin doesn't close fast enough, and the person went for massage therapy after. That actually opening the possibility that the massage oil, the sweating from massage could cause some trouble.
You mentioned a certified acupuncturist. Who actually performs acupuncture? How does somebody get certified exactly?
In Canada, I should say in Ontario, because we are in Ontario, I'm more familiar with the legislation. Acupuncturist is a protected title for those who are the member of the College of Traditional Chinese Medicine of Acupuncture and Practitioner. So that is a protected title. But for other healthcare professionals like chiropractor, physiotherapist, dentist, massage therapist, they incorporate acupuncture into their services. So they are also allowed to practice acupuncture, but they're not acupuncturists. So those will need to meet their own individual college requirement so that they are allowed to use acupuncture as one of the modality to help their patients. So basically, a lot of healthcare professional can practice acupuncture. The full training of acupuncture are those who claim they're acupuncturists and a member of the college in good standing.
Is there evidence to support acupuncture as a possible pain relief treatment?
Well, by inserting a needle in a specific location in the body, a series of events could be elicited, like producing a signal that travels along the spinal cord to the brain and trigger some release of neurotransmitter like endorphin. So that part we have some understanding how acupuncture works. However, the benefits of acupuncture are sometimes difficult to measure. Many people find it helpful as a means to control a variety of pain conditions. According to the National Institute of Health, a number of studies suggest that acupuncture works particularly well on chronic pain, such as back and neck pain, or osteoarthritis of knee problem or headaches. It often reduces the incidence and severity of tension headache and may prevent migraines too. So for the National Institute of Health, the stance on acupuncture is acupuncture appears to be a reasonable option for people with chronic pain to consider. Some systematic reviews suggest that look at whether acupuncture could improve pain and joint function in people with chronic knee problem. They compare true acupuncture with fake acupuncture. So fake acupuncture could be retractable needles, could be a needle not putting an acupuncture point, but 2 centimeters away from it. So people receive true acupuncture, again, receive some long-term, short-term pain relief up to 13 weeks, and somewhat improving physical function, again, up to 13 to 26 weeks. So there's some preliminary study suggesting acupuncture actually help.
So when we, just to recap, I guess there's a physiological reasons why acupuncture may have trigger benefits in terms of pain relief, just by virtue of how it stimulates the nerves and how those signals may interfere or at least send different signals to the brain. And then from a research standpoint, it sounds like acupuncture is a complementary thing from that standpoint. So you mentioned the National Institute of Health in the US and some of the research studies. most of them would still recommend for chronic pain going through the sort of best evidence clinical guidelines. But I think what you're saying is there are some systematic reviews and other evidence using controlled trials with sham needles versus real acupuncture where there was an additive benefit in terms of pain or function with the acupuncture. Is that accurate?
Yeah, I think so. Because when we look at acupuncture, we probably ask a few questions. First, is there any understanding how acupuncture works in the body? So some basic science is needed. Then we need some good trial to understand the benefit. And then we need to look into the whole picture, pull different trials to collectively see if there's a true benefit. And acupuncture seems can pass through all these three steps. And that's why it could be an option for people who has chronic pain, knee problem, to consider that as a modality to help their condition.
It does seem like most of the higher quality systematic reviews seem to relate to chronic knee pain in particular. Is there some reason why the knee would be one of the areas to study, or is it just that there are so many people with chronic knee pain looking for additional benefit?
I think for chronic joint pain condition, so we based on preference, knee problem, shoulder problem, neck, back, and maybe elbow are the most common joint pain, and people seek help from traditional Western medicine approach to a whole variety of different things, especially when the pain lasts for, say, more than 3 months or 6. They affect the function. They try everything to help their body to get better. That's why we see more study coming from those areas. So knee is one of the most common for sure. If we count the number of total knee replacement that we need every year, then we know knee is a common joint problem.
Getting back to the patient, Margaret, who is 59 and she's having worsening chronic pain with her knees, despite optimal conventional management. How would you approach helping her?
I would say we would suggest a multimodal approach to any chronic condition, including an OA knee, osteoarthritic knee joint problem, which means not one single modality is going to paint the full picture. By combining the best evidence, say using medication, physiotherapy, and maybe including acupuncture too, to help the patient to regain the physical health. And of course, most important thing to me is education. Help the patient to gain back to a healthy lifestyle, maybe a little bit weight control, and understand the cause of the disease. Because it's not one single or the short period of management. When we deal with osteoarthritis, it's an internal derangement of the joint. So it's a long-term management. So patient education, lifestyle, weight control is very, very important. We can take the pain, control the pain. We can control inflammation, but it bounds to come back due to internal derangement, degeneration of the knee joint. So how a patient can adapt their lifestyle to stay healthy, to stay strong in their body, to protect their knee joint from further problems from another episode of knee pain. I think that's a key. So it should be a multi-modal method. It should be focused on lifestyle adaptation. It should be patient education for self-management.
We actually have some other e-learning on the portal that talks about the benefits of exercise and weight management as part of that multimodal program.